is back, though like everything this year, it's looking a lot different due to coronavirus. Dr. Dave Hnida is here to talk with us about football and some of our other COVID concerns. Dr. Dave, last week Governor Polis announced 5,700 fans will be allowed at Mile High, starting with the September 27th game. So what's your reaction when you heard this news?
Actually, a good reaction. I think when you take a look at what's going on in the state, our numbers are improving, staying steady, and I think that the Broncos have come up with a very thoughtful and a very cautious plan to get some folks back into the stadium. It's really good to see, and I think helps us feel a little bit more normal, although we still have a way to go. I think it certainly is a better plan than what many other teams in the NFL are doing, as well as other venues and organizations around when it comes to really taking a look at protecting the public health of the community. I mean, if you look at the steps that they're taking, they are limiting the number of fans in the stadium. There's going to be social distancing within pods. There's not going to be any tailgating. There's going to be contactless restrooms and concessions and so on and so forth. So they're taking many steps in order to keep this as safe an experience as possible. And what we hope is that as time goes on, it will just continue to improve here in Colorado, and those numbers that are able to come back into the stadium begin to increase as the season does wind up going on. I think one other thing to keep in mind here is what makes this a little bit of a better situation is the fact that it is outdoors, so ventilation is good. And I certainly would probably feel a little bit more comfortable being able to go out to the stadium than being packed into a place with other folks at somebody's home or even in a sports restaurant or bar where you're watching a game. So I think the in-person experience hopefully will continue to improve and increase in numbers.
I'm sure our fans are happy to hear that one. Well, switching gears now, a recent CDC study found people who dined in a restaurant were almost twice as likely to get coronavirus. So we know there's an increased risk when you are inside, which is why many restaurants have that outdoor dining. So tell us, are you concerned as the weather gets colder and more people go inside that coronavirus cases could go up?
Yeah, this is really kind of an interesting study because the CDC did it, and they found that people who were diagnosed with COVID seemed to have a link to restaurants. They were more than twice as likely to say that they had been at a restaurant or bar within 2 weeks of getting symptoms. And the same sort of link was not found with other places, things like grocery stores or churches or hair salons, so on and so forth. And so you say to yourself, well, gosh, this is really risky. But I think the one thing you have to take a look at, they did not really look at the factor of whether or not it was indoor or outdoor dining. So we can't definitely say that, going to a restaurant in any way, shape, or form is going to be something that's extremely risky. We'd like to see restaurants begin to open back up again and get more folks in. But you're right, there is the concern. Ventilation is a key. Good air circulation is a key. And as the weather winds up getting chillier, there's going to be less and less opportunity for people to be able to do outdoor dining. And that obviously is a big concern. We can only hope that we're going to be able to continue to drop our numbers.
Yeah, the weather in Colorado always plays a different role. Well, we also know that the race is on to get a vaccine approved, but a new CBS News poll found that only 21% of voters nationwide said they would immediately seek out a vaccine if it was made available this year. Is it a concern that people won't want to get a vaccine even when it has been developed?
It's funny, you look at all of us, months ago, we were thinking to ourselves, well, we're going to get a vaccine in the year ahead, and we'll be able to get life back to normal. But the problem is not just this poll, but other polls and studies have shown that as time goes on, fewer and fewer people are saying that they'd be willing to get a COVID vaccine if it becomes available quickly. And that's a little bit of a deal that makes you nervous because you think, well, what's going on here? Why are you not going to get a vaccine? These are not necessarily people who are anti-vaxxers. They're people who do believe in vaccines. And there's even no difference in terms of party affiliation when it comes to where you are politically. I think that everybody has one thing in common when it comes to a vaccine coming out very quickly, and that is fear. They really are afraid that this vaccine has not been tested enough, and they're going to wind up getting sick from the vaccine or have a side effect. There are a lot of other factors. We worry, how effective is the vaccine going to be? We think if we get 50% effectiveness, that's going to be pretty good. We also look at how hard it is to distribute and administer. We also just look at all of the other factors that are involved when it comes to the vaccine. But the number one thing is really trust, and it is a fear about the safety of the vaccine, because we keep on having this drummed into our head. This is being rushed to the market. You know, the last vaccine that really came the quickest was a mumps vaccine, and that took 4 years from the time it was first in study to the time that it was available for distribution. So we're compressing this, and obviously the technology is better these days than it was 40, 50 years ago. But still, there's a concern that politically there's a lot of pressure here to get this vaccine out and into literally the arms of people. Now, I think another concern here is who are you going to listen to for advice when it comes to getting a vaccine? Is it going to be the government? Is it going to be politicians? Is it going to be media? Who are you going to listen to about vaccine effectiveness and safety? It really is going to be your doctor, provider, healthcare experts. And where the problem is there is we're having less and less confidence in the institutions that are in part helping to develop this vaccine. We're losing trust in the FDA. We're losing trust in the CDC. And that's a big problem, because we need that trust in order to be able to say to our patients, hey, it's okay, get this vaccine, even if it's available November 1st. It's going to be good to go. You're going to be just fine. We have a level of distrust there that's not really a good thing to have in a public health emergency like we're having right now. I think that we can just hope that we're going to wind up having transparency on the part of the people who are manufacturing vaccines. They say that they're going to be transparent, but already we're seeing not a lot of information come from them. And so I think that as healthcare providers, we're all a little bit nervous about what's going to wind up happening down the road. And I do think that this is going to be a tough road to hoe when it comes to getting people to just roll up their sleeves and jump in line and get a vaccine if it comes to market a little bit too quickly. We need to be confident in getting this vaccine.
Yeah, that's very, very interesting points there. Well, Dr. Dave, it's always great to talk with you. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.